This side I have injected, and so you can see the difference here. This is really soft, it's muy suave. This over here is not. This has been filled with the fat. Hi, it's Dr. William. I'd like to show you a couple of things here that are interesting about fat grafting. And here we're talking about fat grafting to the breast. We use fat all over the body. It's really amazing. There's several different types of fats that you can graft depending on what you need it for. So if we're talking about a BBL, we typically use a larger particle size and higher volumes, a bigger area, so to fill in the hip dips and get projection in the shape, we're going to need a little bit more volume. When it comes to the breast, we use a smaller particle, and we use it primarily to help augment the breast. It's not going to be the same volume as a breast implant. A breast implant will always be more. We can't put the same amount of fat into a breast as we can with an implant. So if you're really looking for a size change, then usually we will use an implant. Sometimes we use implants with fat, but that's a different story. But this patient didn't really want to be bigger. So we're doing a lift here, and lifts never really look good in this position on the table because you just see a bunch of scars. But I think she's going to look very nice. But what I'm using the fat for here is shape. So not necessary volume, because she doesn't really want to be bigger, but she wanted to have a little perkier, fuller breast when we're doing the lift, and so that's where fat is really helpful. So I'll just show you the difference. Here she is on this side, and you can see how flat here. This area here, you can see I haven't put any fat yet. This is all hollow and flat, and this is going to be the upper pole. This is the upper part of her breast. So when we do a lift, we use an internal bra to support this lower tissue and to support the breast, but then we can use fat to fill in the upper pole. It's not going to provide her with a lot of volume increase, but it's going to provide her with more fullness and more cleavage. So you can see there's not a huge size difference between her breasts with the amount of fat that I've added, but it's going to give her a prettier shape. So I'm going to do that on this side as well. One other point that I would like to mention is, so there's different fats, different particle size, depending on how we process the fat. Okay, so one of the other interesting points I'd like to point out is there's two different types of fat that we can use in the breast, and that is this microfat. So this is a bigger particle size, and then this is what we call nanofat. This is thinner. This nanofat here, you can see it comes out fairly easily, and it's thinner because it's smaller, and it comes out and it's a little bit more in this liquidy kind of smaller particle size. That's the nanofat. This is not going to give her the shape, but what this nanofat does is it's really good for the skin. And so the nanofat's typically used in the face, and that will help rejuvenate the skin. I like to put a little bit on top after I've done the structural fat, the bigger fat. This is the structural fat here, and you can see that it takes a little bit more force to come out, and it's a little thicker, and the particle size is a little bigger. It's still very small, but it's just a thick, and there's a little bit of blood in there. There's a little thicker base to it, and so it's better for giving you the volume change. And the smaller fat's good for the skin. So I've already injected this fat into this breast. That's how we got the cleavage, and we got the upper pole fullness combined with our internal bra down below. We're going to help support that breast, and we'll get more fullness here. Now I'm going to use a little bit of this nano fat, and this is this small, really thin stuff. It's really beautiful. It contains all these beautiful factors and everything else in here. And this one I'm just going to put in really superficial, so really close to the skin. And remember, this is not something that's going to provide structure to the breast. This is primarily here just helping the skin heal and helping the health of the skin. So whenever I do fat graft into the breast, I always use nanofat and I always use the microfat, so we get a combination of structural change, so we can get the shape change, and then I use it as well, the nanofat, to get the skin better.